Dr. Kevin Most is living in his new place. He's moved out of his palatial estate into a 400 square foot apartment. So, there's downsizing, and then there's what?
Downsizing.
But how are you, Doc? You good?
I'm good. I'm not used to this yet, but it's very interesting. I used to get a lot of steps in my house. Now I take like 2 steps and I'm in another room.
It's always good when you can start dinner and then go sit in the bathroom and still be able to stir the pot because you can reach the oven. So at 7:39, I thought this is a great question. This is from a 630 texter. My husband has diabetes and several other medical conditions. He's multiple doctors, has a lot of prescriptions, all filled at the same pharmacy. How confident can we be that the pharmacy is looking at the big picture with interactions? And if the process is automated, or is it human observations, or is it both? And with pharmacies being as stressed as they are now, what do you recommend that we handle this to make sure that we're taking care of ourselves?
You know, Steve, in this world of what we call polypharmacy and polydoctor, where, in other words, like she said, her husband sees many different specialists. And now if they're all in the same medical group, say they're all at Northwestern, they're all on the same medical record, then the doctor really has a lot of that authority as well and a lot of that oversight, because as they put it in, it's going to be collectively all in one place. For her, it may not be that way, but it certainly sounds like her pharmacy is the single source of correct information. Now, certainly it is automated, and as a matter of fact, I would strongly recommend that this listener go online, go to the App Store. There are hundreds of, I shouldn't say hundreds, but there might be hundreds now, of drug interaction applications. Put in all your medications, and then that is very reassuring to yourself. So certainly take some ownership as the individual taking the medication, that this is simple to do now. In the past, before we had electronic medical records and before we had these apps, you had to remember which ones. There was a book called the PDR, which is 3 inches deep and had every single drug in it. And it was a lot of, I have to remember that this drug can't go with this drug. Now we're much more fortunate to have not only the apps that we can do ourselves, but that the pharmacy does that, and good that you only go to one pharmacy, but also that the doctors and all their specialists, if they're in the same medical group, will also be checking. So you should be reassured that there's at least 2 levels, and you can add that 3rd level of safety yourself.
And you got an app that you prefer? I mean, I've used drugs.com for years, but some of that information can be confusing and need some professional interpretation.
Yeah, I mean, Pocket Pharmacist is a really good one. WebMD has a really good one. Those are both very easy to use. So those would be 2, I think. And it's kind of hit and miss. I shouldn't say hit and miss, but trial and error. See which ones you like. See which ones are easy for you. The vast majority of these, you can either put in the trade name or the generic name, and it's going to pop up. Some of them have ads, but, I mean, you're getting a lot of information.
Jane, question for Doug.
Well, Dr. Most, I think it's smart, first of all, to be aware of drug interactions and manage it yourself rather than trusting somebody who could potentially have human error. But that's a whole nother thing. And you must feel like you're living in an Airbnb in your new place until you get actually used to it and you have to stay there.
It is an Airbnb. He's renting it from me.
Just feel like, when you go somewhere the first time, you're like, do I live here? Dr. Most, so let's talk about dizziness. In my home, there's been a case of, I feel dizzy just upon waking up and then moving about the day. Is
this you?
No, it's not me. It's a friend.
Is this your husband, Kurt?
It could be a friend that I live with, but not consecutive days, and typically not a dizzy person or ever has been dizzy. But what can cause dizziness? I said, maybe you have a touch of vertigo, and that person said, No, I don't have vertigo.
And then he fell against a wall.
But what is it? What's causing this dizziness when you're waking up and then throughout the day and for it to go away and come back?
Yeah, absolutely. And you hope that it's vertigo. And vertigo, the medical term for it is called benign positional vertigo. And what that means is that as we position our head in a different way, the symptoms of dizziness come there. So it's absolutely amazing when you look at the human body and say, how do we not get dizzy, right? And how do we keep our balance? So our balance is based on 3 things. Our vision, so we can see where we're going, receptors on the soles of our feet, and then crystals in our inner ear. Our inner ear is the other third thing. All three of them send messages to the brain to say, this is the body position that we're in. As long as two of them are working, we're fine. In other words, we can walk in the dark. We can't see anything, but our receptors on the soles of our feet are telling us one thing, and our brain is telling us, our inner ear is sending a message to the brain saying, this is the position we're in. What happens is when we have one or two of those off. In other words, if the brain is getting something from the eyes and the soles of the feet, but the inner ear is telling the brain something else, you get a sensation of dizziness. So benign positional vertigo is almost always due to crystals in the inner ear. And it's something that they get disrupted. They end up hitting some portions of the ear, and then they send a message to the brain saying, this is the position the body's in, and the body's like, no, it's not. And you get the sensation of dizziness. That being said, you have to make sure that it goes away. If dizziness continues, there can be other issues. So you certainly want to make sure in the back of your mind you've at least tried that. If you want to try medications, they're okay. They're very strong antihistamines, and they rarely work, but they can. This often is, like I said, benign. It's not caused by anything major, and it'll go away on its own. But if he says, hey, I want to get rid of this quicker, then Google Epley maneuver, E-P-L-Y maneuver. And what it does is essentially tells you what position to put your head in, what order to get those crystals back where they belong, so that they're sending the correct message to the brain.
Yeah, by the way, it's E-P-L-E-Y, Doc, but you're not here to spell.
But it doesn't vertigo happen from, let's say, you're either sick or maybe you're flying, like the high altitude. There's always all these reasons. Or can it just happen because the crystals are dislodged?
Oh, yeah, it can happen. It can happen without anything really happening. Moving your head quickly can certainly cause it. So, yeah, it can happen. People get it after being sick, certainly after, vigorously coughing, after laying in bed for long periods of time. So certainly there are some things that can bring it on, but there's other times where it just happens and it's like, wow, there's no reason, it just came on. So certainly something that, like I said, should go away and can either try the medication or can try the Epley. Thank you for the correction on the spelling, Steve. That was my third grade spelling. It's like, man.
No, it's fine. You're busy. You're busy saving us.
Yeah.
All right, we come back. One thing that's not the end of the world, but it's certainly annoying, and that is carpal tunnel syndrome. But then we'll talk about a couple of the bigger items we missed from last week and more with Dr. Kevin Most, who will ask me to turn my head and cough during this break. It's Dr. Kevin Most. Doc, I don't know if this is a legitimate medical question, but yesterday I took, your private jet and I flew to the Met Gala, and my outfit was elaborate. It was a Met Gala, and I've got some unfortunate chafing. Should I call you later about that?
Yeah. Much later.
Okay.
Much
later.
Later.
Here's a legitimate celebrity item. Miss USA has suddenly resigned and urges people to prioritize mental health. Her name is Noelia Voigt. She's become Miss USA in 2023, and she stepped down Monday. What are you going to say, Jen?
Well, she cites our health as our wealth, which I think is really important to remember. You're not any good if you're not healthy, right? You're not any good to anybody else.
Yeah, 100%. All right, so, Doc, our friend Andrea Darlis was complaining of what seemed to be keyboard thumb and in having that basic carpal tunnel situation last week. Wear a brace, rest it. Any remarkable fix there?
Well, you hope you catch it early enough and understand the motion that's causing it. And actually, it's really interesting. Up until we started using computers as frequently as we are now, this used to be a disease of repetitive motion for other industries like butchers and chicken manufacturer where they were, processing chickens. Now it's a, kind of a white collar kind of thing because of the number of keyboards. What we found is that, all right, we're going to switch to everybody using all these computers. But what we've done is we just said, hey, take a regular desk, slap a computer on it, and next thing you know, the ergonomic position of your wrist is not good, and you're doing this pounding where pounding should not happen. And when that happens, you get inflammation in one of the nerves that runs through the part of the wrist there that really isn't very well protected, and it's called the median nerve, and you can get numbness and tingling, and you can get weakness. So what do? Well, doc, it hurts when I do this. Okay, well, stop doing that. The simple thing. So, but that's very difficult because people say, hey, I have to continue to use my computer. So taking anti-inflammatories, wearing braces at night, at least that can help a little bit. But eventually, sometimes you're going to need to have surgery because scar tissue will build up and you have to go in and do a carpal tunnel release. So it opens that up and takes that pressure off of that median nerve. But it's really something that we can prevent ourselves as long as we ergonomically make sure we're using a good keyboard at the right level so that our wrists are not bent and continuing to put pressure on that inner aspect of our palm.
All right, another question that comes from Andrea's world. She lost her cousin to cancer and the after effects. Early onset cancer. Her cousin wasn't in this particular demographic, but we're talking about people under 50. You're seeing more of this.
Yeah, we're seeing a lot more of it. The study just came out actually about a week and a half ago that showed that over the last 10 years, we've seen an 80% increase in early onset cancer. And you can see, wow, but the medical field has noted that, right? Look what's happening with our screening for cancers. We used to start breast mammograms at the age of 50. We've now moved that down to 40. Mm-hmm. Look at colon screening. We used to do it at 50. Now we're moving that down to 45. And lung screening, where we didn't even lung screen before, but now we're moving that down. So certainly the medical field is starting to see it, and I guess it's really important that we get it out because some people think, I'm not going to get that test. I mean, look at the number of women. A third of women don't get their mammograms done just because they don't think it's necessary or they think it's uncomfortable, or they think it may not be covered by insurance, but they have to understand that with the Affordable Care Act, it is covered. So we have to make sure it's more education of the public that cancer is starting earlier due to many reasons, environmental reasons, sedentary lifestyle, increased diabetes, increased obesity. There's many reasons why it's started. And if we're not going to treat that portion of it, we at least have to start to make sure we're identifying it earlier.
Yeah, it's interesting, too, because it's not just connected to family history anymore. There are so many other reasons why we're seeing more cancer. Dr. Moses, we're talking about nurses because it is National Nurses Week. You're telling us that there's a physician's shortage.
Yeah, Jane, and thank you very much for bringing up Nurses Week. Steve and I, every year, would talk about Nurses Week, and then this year, I think he finally wised up and said, why don't we bring a nurse on? And very nice that Sue McCoy was able to join you guys. She's just a phenomenal nurse leader and was a phenomenal nurse taking care of these little NICU babies that, as I said to Tom and Steve, she takes care of babies that are the size of a beer can.
How about that?
It's just amazing what they do. But Jane, you're spot on. When you look at what's going on across this country, we are so short. How many of you have tried to get into your doctor and they tell you, you can't get in for 3 months, you can't get in for 4 months? So certainly we have this shortage, and we're going to try to figure out what do we do. So we're starting to bring extenders, we'll call them, physician extenders. We used to call them mid-levels, which is kind of felt to be a derogatory term, so more physician extenders. And those are physician assistants and advanced practice nurses. You may have seen those in your doctor's office where you're seeing the PA or the APN. But we know we need to work on this shortage because baby boomers are hitting this age where they need a lot of doctors. I mean, you had a listener today say, hey, my husband has diabetes, sees multiple doctors. We're going to need to really have to fill the void, whether it's with more physicians or fill it with these very educated APNs and PAs that are going to help us so that people can get into the healthcare system easier.
Is AI going to be part of that?
Absolutely. AI is the things that are going on with AI, Steve, are just unbelievable. There's two big ones that came out last week. One is that there's a program, an AI program right now that is able now to predict when someone is going to go into atrial fibrillation. We've talked about AFib in the past, and many people have heard about it. The heart has 4 chambers. The ventricles, the bottom parts of the heart, those are the big pumps. Those are the most important 2 chambers. And then there's the 2 upper chambers, the atrium, and those are the holding, essentially, where they hold the blood before it goes to the ventricle, before it's pumped out. They're supposed to contract just like the ventricles do. But in atrial fibrillation, it fibrillates, so it shakes, and that causes many problems, increase your risk for stroke and for heart disease. But if we could predict before you went into AFib based on AI, on looking at everybody who's wearing smartwatches now that's monitoring their heart rhythm, boy, we could stop that from occurring and treat it. So that's going to be fascinating. And I think now the other thing is we're collecting so many data points right now for diseases that we knew little about. There's a study going on in China right now where they're looking at just taking a drop of blood and looking for metabolites of people who had pancreatic cancer, cancers that are very difficult for us to screen, gastric cancer. And if we can get more data and say, hey, take this drop of blood, look for it, look for these metabolites, boy, those are the ones that we saw in these patients, we're certainly going to be able to identify difficult cancers that we can't screen for now earlier. So AI is, boy, I'll tell you, we're going to be talking about AI for a long time, but it's fascinating because we have so many data points. And like we talked before, doctors used to write on paper. We don't write on paper anymore, right? We put things in electronic medical records. So we have these data points now that can be collected and looked at on a much bigger level than looking at somebody's handwriting and say, does that look like a 3 or a 4?
Well, I mean, part of the reason we had to go to that is because we couldn't read your writing.
Absolutely. Hey, and you know what? Think about it. We had to go to this because we're not teaching kids how to write anymore.
Nope. Nope. It's all keyboarding, baby.
And then soon you'll get our diagnosis through emojis.
Exactly. Jane, good luck when you go home later. I hope Kurt doesn't run into you.
I know.
He has difficulty not running into objects.
We'll do the Epley maneuver. That'll be fine.
Yeah. Doc, thank you. Good luck with the new situation. And if you're moving, don't forget to hire 2 men, a truck, and a doctor. Doc's new service that he's doing.
You got it. Hey, and again, thanks to all the nurses out there. I know we just think of nurses in hospitals, but they're in physicians' office, schools, public health department, insurance companies, and thank you very much for everything you guys do every single day. You're really the strong part of the medical field.
Amen, buddy. Amen. Thank you.